stand up. Thank you. Welcome from my side as well. I'll do this in English, so hopefully it's okay. Some of the key challenges we see in healthcare and then how we are approaching it from an ASCOM point of view. We've been around for quite some time. We've dealt with mission-critical environments since the beginning of ASCOM, and we're very excited about what lies ahead for us. We're headquartered in Switzerland, about 1,300 people. So big team. And our vision is really to close digital information gaps and allow people to make the best possible decisions anytime, anywhere. I think healthcare is one of the markets, one of the industries where this is really important. We've seen it a lot with COVID. I think a lot of the challenges were there before that. COVID did not create the challenges, but COVID really brought them to the surface. So it was very prominent that we have a problem. And that's not one country. I think probably every country in the world realized they have weak spots and they have areas of improvement. I was thinking, and I was preparing and putting some slides together for this presentation. I started my career in London with Frost & Sullivan in healthcare consulting, and I was the first analyst in Europe back then in 2004 for Frost & Sullivan, exclusively focused on healthcare IT and healthcare technologies. And back in 2004, everything was about EMR and PACS and RIS and all these new technologies. So this is a slide I was presenting back in 2009. And I was doing a presentation about healthcare 2020. And this is where we're going to be in 2020. And if I ask you, have we moved or are we closer to this side? I think for most people will say, well, we still talk about the same things. We still talk about personalized medicine. We still talk about patient-centric, and we need to be closer to the community and less invasive and all these things. But we're now 2023, so 14, 15 years later, nothing has really changed. But the focus is still the same. So why has healthcare, and healthcare is perhaps the most difficult industry to change, why is it so hard for healthcare to change? And we can say, I don't know how many doctors we have in the room, but we can blame doctors partly. They have very strong opinions, and they're used to certain way of working. The other fact is, and it's a reality, we're dealing with people, and we're dealing with people's lives. So it's very easy if you are in any other industry, retail or hospitality, to say, hey, I'm going to change something, I'm going to introduce a new system or a new way of working. You don't have a risk that people will die. In healthcare, if you change something, you're dealing with people's lives. And it's one of the reasons perhaps it takes a little bit longer. Having said that, I think probably in the next 15 years, we're going to see a lot more change than we've seen in the last ones. And why is that? And I'm trying to simplify it perhaps a little bit, but if you have an object at rest, and this is Newton's first law of motion, but if you have an object at rest, unless you have a force that's moving that object, nothing is going to happen. On the other hand, if the object is moving, you need to have a force to stop it. So what I think really happened in 2020, the foot connected with the ball. There were a lot of these challenges, a lot of these issues brewing up. A lot of, what we talk about today around efficiency, about lack of skilled nurses and doctors, about quality of care, they were there before. I'm 20 plus years in the healthcare industry. We keep talking about the same things. But I think the pandemic really had a huge impact because it made everyone realize that, hey, we really have a problem. And of course, there were a lot of these, what we call megatrends at play that I think the pandemic amplified it. We see it now. We see a lot more investment. We see a lot of more focus in healthcare. I'm originally from Greece. We have elections in 2-3 weeks from now. Number one topic of the discussion is healthcare and how much we need to fix our healthcare system. So we see it everywhere. I'm sure it's the same in Portugal. We see it in Spain. We see it all across Europe, which is a good thing, because it means, okay, we can probably do something about it. So if I go into a few of the megatrends, and I'm sure a lot of you relate to this, of course we have demographics, we have people getting older, which means you go into a situation where you have a lot more chronic diseases, for example. Patients are becoming more clever. Everyone now has a mobile phone, we have social media, we have expectations. Because I can use my app here, and I can connect with my bank in Switzerland or in Germany, and I can see my bank balance, and I can do transfers, and I have access to experts if I need to speak to. And then where is my medical record? If an emergency happens to me here, no one has a clue if I have an allergy or not. Right? Sometimes I can go for my hairdresser, and I can go online and book an appointment in 5 minutes. And if I need to go and see a doctor in Switzerland, I have to actually call. And I have to spend 20 minutes identifying myself. So we have a lot higher expectations, because we've seen it in other parts of the markets we operate in that we expect or we would like to see from healthcare. And that creates a challenge, but also an opportunity for us. And then, you know, all the other usual stuff around digitalization, of course, happens in all the industries. Regulations is a very important topic for healthcare. We see it when it comes to frameworks, when it comes to privacy, a lot of these things. So it's a hard environment to navigate. And I'm just going to pick on a few of them. I know we're running a little bit behind on the time. I was showing this slide also back in 2005, 2010. It had actually less numbers. So this is the number of people over 60 years old globally. So in about 2000, we were talking about 610 million people. 2025, which is 2 years from now, we double, 1.2 billion are over 60 years old. And then 30 years from now, we're going to be close to 2.1 billion. So we've gone between 2000 and 2025, we're almost doubled, and then we're growing another 74% in the next 25 years. Which means from a percentage point of view, we had 10% of the population over 60, and now we have 22. So it really is a huge burden. And why it is also a burden? Because it leads to something like this. Back in, when was it, 1990, was probably 30 years ago, 35 years ago. We had a lot less chronic diseases. So people who used to go to the hospital because they have an accident or something happens, and then you had an element, yes, there was still a certain number of older people. Now we see a lot more of that. But what has happened, we have a health system designed for this, who's trying to manage this. Because if we look at the health system today, it's hospitals and doctors. But most of us really suffer from this. We suffer from blood pressure, we suffer from diabetes, we suffer from back pain. You cannot keep going to the hospital because your blood pressure or your blood sugar is fluctuating. And that's a little bit where we, as an industry or collectively with governments, we have a role to play. How do we prepare ourselves for this kind of environment? Because this is going to keep happening. And people thought, well, you know, perhaps a pandemic can slow this down, but it hasn't. And that's not the way to approach it. Another element that it's important to keep in mind, if you look at, on any population, about 70% of people are really healthy. They don't have a problem. And then you have about 20-25%, we have chronic conditions, or they need chronic management. And then really the acute episodes is about 5% from a total population point of view. But when it comes to the cost of handling the people, the whole chronic acute, let's call it that 30% of the population is responsible for almost 90% of the cost. And cost, let's generalize, let's say resources. So it's quite interesting when we talk about improving the situation here, it is going to have a huge impact on the other side, which means we can do more with less or we can provide better things to the people. Very busy slide. I apologize in advance. But what we see, at least in ASCOM, and in ASCOM we are active in healthcare, we're active in long-term care, which is elderly facilities, and we're kind of starting to see that. A lot more in Northern Europe, Sweden, Norway, Denmark, for example, Finland. Part of it is flowing down to Netherlands. It's not so common yet in the south part of Europe. But what we see is the lines between being at home and being healthy and being sick in a hospital or being in a long-term facility, they're starting to blur. Because what you have is you have people, they're already very health conscious. You know, you have your Fitbit trackers, you go to the gym, you have your apps, you have your communities, you're doing a lot of, you take supplements and things like that. And then you have your community, you have your pharmacy. If you feel a little bit unwell, you'll probably go online and do a bit of Google search. Or I have a pain here, what does it mean? We all done it, okay? Your first point of contact, depending on also your health system setup, will be some kind of clinic or primary care doctor. And there it can be something simple, okay, you have the flu, take a bit of paracetamol, you're fine after 3 days, or you might have something more serious, and then either they treat you in primary care, or they will send you to the hospital. And then you go to the hospital, you could go, you could do a couple of checks, come back, you can stay there depending on the problem. Many cases, there might be, oh, you have a bit of a chronic condition, so we're not going to keep you in the hospital, but we need to monitor you. So come back after 3 weeks or come back after a month, which then you start going perhaps into more long-term kind of facilities or settings, which could be not necessarily an elderly care home. It could be you are at home, but you need to be more monitored. You need to be more assessed, for example, especially with diabetes and all these things. I mean, it's very common. Early diabetes patients say, okay, you know, measure yourself 6 times a day or 10 times a day. So we monitor that. So the lines between, you know, are you in the hospital? Are you in a facility? Are you in the doctor's office? Are you at home? We're seeing it starts to blur. And the challenge is, from a health system point of view, we look at everything in silo. Hospital is separate. They have no clue what happens in long-term care facilities. In some countries, it's even separate. So you have hospitals through the health system, and you have care facilities through the social care system. And even the money flow is different. So they don't talk to each other. Part of the challenge. And then also, of course, the value chain is changing. So it used to be more who has the best equipment, who has the best educated doctors from Harvard and MIT, or how far is the hospital. And then for a hospital to be efficient, we used to look at, you know, how many doctor hours you have and how many patients can you see and how many surgeries you do and all these things. But we're seeing now it's changing because that's not important anymore. So it goes more, you know, why do I have to even go to the hospital? Why don't we have an app, or why don't we have something I can, you know, measure myself? Can we do a video consultation? We saw that exploding during COVID. I would love to be able to read a review or see some stats around quality if I am to do a surgery or if I am to go to a doctor. And of course, you know, you can do a bit of Google search and do a review, but proper validated facts so we can make better decisions. And the demand is there. So it's going to keep putting pressure on us how we can do that. And then, of course, all the new things coming up, AI, blockchain, everything else. So we see this happening a lot, and it's a question of how do you respond to it? How do you enable and you support the whole industry, from the government to the patients to obviously companies in the space, to be able to deal with these challenges. So I'll give you a very quick overview on the ASCOM healthcare strategies and how we see things. The way we position ourselves is really to be the enabling platform that sits in the middle, and we connect with a lot of different other technologies, solutions, products out there. An easy example I can provide is you go into any hospital, you can have hundreds of different medical devices. We're able to take all that information from the medical devices, filter it, process it in a way that then we make it actionable. So perhaps 90% of alarms generated by a medical device, it's not actionable. You don't really have to do anything. But there's a 10% that you really have to do something. So if in a typical ICU room, you get 500, 600 alerts for every device every day, and you have 20, 30 rooms, it's thousands of alerts that a nurse or a doctor has to go through. If we can bring that down to 50, which are the really actionable ones, then we solve a lot of problems, because then there's less fatigue. People are a lot more specific on what they can do about it. So one example how we, through our platform and our solutions, we really solve some of these problems. This is and we keep talking about platform because it really is many things together. It's not one product, or it's not one solution or one software we can use to do this. It's a platform play. Of course, we have software apps. Of course, we have hardware devices from very standard nurse call systems, what we call, which is next to your bed on the hospital, you have a button and you press it and the nurse comes, to mobile devices, services, and all the other stuff. But for me, what's important here is that it's also about partners and partnerships, and we integrate and we interface with a lot of people in the industry and in the ecosystem. As an example, we have, and Gianluca, you'll keep me honest here, I think we interface with more than 600, 700 medical devices, where we can pull that information, and through our platform we can make it actionable. And I'll finish with this slide, so we're there. So when it comes to acute care, a bit more specifically for us, and acute care we define as more the hospital side of care, what we're really trying to do is to make it a lot more connected, a lot more safe, and a lot more data-driven. And some of the areas we're really focusing on from our side is around staff safety, patient safety, clinical collaboration, so people can really work a lot more efficiently together, and clinical decision support. So that's an area for us very, very important. That the example I mentioned, if someone deteriorates, we can have some early warning scoring, for example. We can have information that we then make it actionable, because a lot of the information is there, and it could be in paper, it could be in an EMR system, it could be in a laboratory system, but what do we do with that information? One example I like to use, I think 90% of the decisions in healthcare, you need some kind of examination or result. So it's either an X-ray or a CT or an MRI, or most often is a laboratory analysis. So you go in, the doctor has an idea or a suspicion, says, okay, we need to get a blood sample, run some lab results, because either it will verify something or exclude something. And then you wait the lab results so you can make the final decision. So what happens? You go, you give blood, laboratory does everything, result is ready, goes into the lab system. How does the doctor know? Either you have to remember and say, okay, let me check now, call the lab. Hey, do you have the results for Mr. Kostas? Oh, yeah, I do. Okay, can you send them over? Or he has to manually go into the system and pull it out and see, but what if it's not ready? And what if you have 20 patients to monitor. You cannot keep doing that. What we can do, we can create a logic through our platform where we say, okay, as soon as this result is ready for this patient, just then send a notification to the doctor on his smartphone or mobile device and say, hey, the result is ready. Would you like to see it? Yes, no. You click and you see it. And it might save 1 minute, but you multiply it by hundreds of patients, and then you really start seeing the difference. Good. I think that's what I had. Thank you very much.